catastrophe for the NHS. So apparently more than 1,300 people a month are dying because of A&E wait times. They're not dying from the illness or the injury that they went there for. They're dying from waiting. The UK has been the only country where the queue is deadlier than the disease. According to the Royal College of Emergency Medicine, we've gone from 30 deaths a week in 2015 to 300 deaths a week in 2025. That's a tenfold increase. Most things that go up tenfold in a decade are either crypto scams or house prices. But no, this time it's the death toll from sitting in a plastic chair under fluorescent lighting for too long. Dr. Ian Higginson, the Royal College of Emergency Medicine president, basically said, "How many more people have to die before Westminster notices?" As if noticing is something that politicians do. The numbers come from a study of 5 million NHS patients showing that once you've waited 8 to 12 hours, your risk of dying goes up significantly. Which is bleak, but also very British. "You've been waiting 11 hours, love. Fancy a cup of tea and a statistically significant increase in mortality?" The risk starts rising after 5 hours, which is roughly the amount of time to find the one working vending machine in A&E. This is the bonkers bit. Doctors say they're being told to focus on the least sick patients to improve headline statistics, because nothing says world-class healthcare like prioritising the guy with the paper cut over the woman who's having a stroke. They also say they're being fobbed off with recycled ideas that never worked. Which, to be fair, is the entire British governance model. The Royal College of Nursing calls the death toll a catastrophe. The Society for Acute Medicine calls it a national shame. And honestly, when nurses, the most patient humans alive, start using words like catastrophe, you know things are really bad. The Department of Health says the long waits are, quote, unacceptable. Lovely. Very strong language. Almost as strong as the language they used last year when the numbers came out. Or the year before that. Or the year before that. They say A&E waits are now the lowest in half a decade, which is like saying, yeah, the house is still on fire, but the flames are slightly shorter. The truth is, A&E isn't collapsing. It's collapsed. We're just walking around the rubble pretending it's modern art. When more than 15,000 people are dying in the waiting room, that's not a crisis, it's a structural failure. It's a system that's given up. So thanks for watching if you made it this far, and remember, watch them closely. They hope you don't.